Ladies and gentlemen, the host for the first panel today, Neelkant Mishra, is a managing director, the India strategist, and co-head of Asia Pacific Strategy for Credit Suisse. He's part of the advisory council to the 15th Finance Commission.
Hello, everyone, and welcome to the show. To discuss ideas on rebuilding the economy, we have two eminent panelists who really don't need any introduction. We have Dr. Krishnamurthy Subramanian. He is currently the Chief Economic Advisor to the Government of India. He is a leading expert on economic policy, banking, and corporate governance. A PhD from Chicago Booth and a top-ranking IITian alumnus. His economic surveys have integrated our rich and economic and spiritual heritage with modern economic ideas, like recently in highlighting ethical wealth creation. Among several other prominent roles, he was also part of the seminal PGNI Committee on PSU Bank Reforms, which I think we'll need to discuss today. The other panelist is Dr. Nachiket Moore. He has a PhD in economics from the University of Pennsylvania. His current work is principally focused on the design of national and regional health systems. He has been a member of several high-level expert groups and task forces on health at the center and the state levels, like the Planning Commission's high-level expert group on universal healthcare. In the discussion today, we will learn about his ideas for a model of universal healthcare, among other things. So welcome both. I'll start off with some remarks to set the context on the economy, and then we get into Q&A. As the regulatory restrictions are being lifted, activity indicators are rebounding sharply. So that's quite encouraging. One must say that they were expected to, however. A sharp rebound to 85 to 90% of pre-lockdown levels is underway. This is being aided by pent-up demand in several sectors. But the concern and the fear is that the progress thereafter may be slower. This would be due to a combination of renewed local activity restrictions, like the deaths and the case count are still rising in many cities. There is a fear among individuals of venturing out, and there is also a concern on weak global demand. For example, inbound tourism is nearly 1% of GDP, and that right now is at zero. Further, the loss of incomes and jobs and lower retained earnings in enterprises would be compounded by precautionary savings by both individuals and enterprises. One of the interesting things that any war-like situation, any public panic does is that even after it gets over, it leaves scars in people's minds and enterprises' minds. And anyone who was aggressively saving was only doing so because he read about it in Jatak Kathas or had been told by his grandfather. In the last 30 years, the people who got awarded or rewarded were the people who aggressively invested and gained the benefits of that. That is not going to happen going forward. And families, likewise, are going to build and rebuild rainy day funds. So it is also possible that some sectors will see strong growth. So we are already seeing things like packaged food. We are seeing areas like, which are benefiting from at-home consumption. So as restaurants are shut, as external calorie consumption, so like ice cream demand is very weak. This is being offset by significant cooking in home, and therefore packaged food production is doing very well. It is going to be confusing for a while as to which indicators are actually representative. But I think there is, for example, even cosmetics can be very weak because people are not stepping out, or party wear. If there are no parties, there's no party wear. There would be expenditure reallocation, and therefore some indicators may show very strong growth, whereas others will stay weak. But I think there's a fair bit of agreement in the fact that aggregate demand would suffer for all the reasons we discussed before. Now, there are many fronts on which action is necessary. In this session, we will focus on three of them. I call them the three healths. The health of the financial sector, which wasn't very great to start off with when we entered the crisis. The health of the corporate balance sheets and the availability of risk capital. And then the health of individuals, which I think has become much more prominent than it was earlier. We will discuss these in sequence, and in the last 10-15 minutes, we will open up for Q&A. So starting with the discussion on financial sector. So Subbu, I come to you first. A critical part of the rebuilding process has to be the financial sector. That means that, if we and you highlighted how important it is to get growth back, even to get debt sustainability. Now, if we have to grow at 10, 11% nominal GDP, we need to get the financial system to grow at 14, 15%. And right now, very significant part of the financial system is licking its wounds, is focusing on survival instead of growth. So how do you see this panning out? I mean, will we see more support for NBFCs? Do we see a repurposing of the role of the PSU banks? Do we see new types of financial entities going back to development finance corporations? How do you see this panning out?
So thanks a lot, Neelkant, and a very good evening to all the viewers. Neelkant, as this is a time for reset in many ways, I think it's also useful to take a dip into how the financial sector in India looks vis-a-vis, other countries. In the economic survey this year, we'd actually shown that the Indian financial sector, especially the banking sector, is quite small compared to the size of the economy. And one can look at it in terms of various different measures, be it the number of banks that we have in the global top 100. China, for instance, has 18, we have 1, and we compare with countries like Denmark, even other countries, much smaller countries, which are about 1/7, 1/8 of our size, actually have more such banks. Second way of looking at that is, the presence of small banks, actually those that lend to small firms and individuals in the economy. Here again, it's useful to sort of look at some statistics. Take the US, for instance, a country of about 400 million population has close to 25,000, anywhere between 25,000 to 30,000 banks there. India, with 3 times as much population, has less than 1/10 of those number of banks. Also, one of the things that we've done, through regulation, especially Basel norms, for instance, we've adopted a one-size-fit-all approach where we've relied a lot more on credit ratings, with, in terms for capital. And what they do, therefore, is to sort of, call into question the basic model of banking itself, which relies a lot on soft information. So these are, very, very critical aspects that we need to really work on going forward, because as you would appreciate, credit is extremely important for growth, and growth itself then becomes really critical, not only for basically reducing inequality, etc., but even for debt sustainability. And that is something which we really need to keep in mind. When you look at private credit to GDP, especially the credit that goes to the private sector, India at about 50% of GDP is really an outlier on the negative side. So democratization of credit, to MSMEs, to individuals, really needs to happen, and that's something which we need to focus on, going forward, if you really need to get the growth back. Of course, you also referred to the fact that, the initial conditions with which we've entered this crisis in terms of the financial sector have not been, very, very desirable. So that's something that we have to really watch out for. I think this is one sector that I think really is crying out for reforms. Structural reforms, where we really need to be thinking in terms of growing the sector significantly, and unshackling many of the restrictions that we've put, as a result of which the sector is quite small compared to the size of the economy, and especially with the focus on small firms, small individuals, etc.
Thanks. So at this point, let me get Dr. Moore in as well. Sir, your report that you wrote on the financial services for small business and low-income households, something that Subbu referred to as well. And India is actually a country of micro enterprises at this stage. A very large number of people working for themselves, pretty much. And so you looked at a lot of history of how past regulations have addressed this problem. You also made some very interesting recommendations for making this a much more diverse ecosystem than what it has been in just large PSU banks. So what do you think, if you're looking out for the next few years, what do you think should be the priority for policy?
I want to build on what Dr. Subramanian said. He made some very good points about what is the direction the system must take. Clearly, I mean, there is no debate that we have a small banking system relative to our size. We have 60% credit to GDP, just to use one metric, when the number should be at least twice as much. But even more worrying is the fact that this 60% is distributed very unevenly. Yeah. If I look at Arunachal Pradesh, that number is under 5%. And UP and Bihar are not that much better off. So not only do we have a small banking system relative to our needs, it's also very unevenly distributed across the system. And then, of course, we have the added problem. We are a somewhat crisis-prone banking system. I've been a banker for several decades. Virtually every decade, you see a reasonable-sized crisis coming to us. So really, in the report that I was a member of, that I chaired, we tried to look at holistically what is going on with the system and what can be done. One level we have to make sure that we do a good job of is that our foundations have to be strong. Some of the unfinished work of bank balance sheet transparency, I think we have to complete. India's we have delayed implementation of. We need to start publishing stress tests. We need to start thinking about risk-based capital allocation, because one of the things that people assume is that you need a bank to push credit out. They have kind of a Keynesian multiplier type thinking behind in their head. But actually, one of the principal tasks of a bank is to allocate credit carefully, particularly when the bond market is not there. So if you do a bad job of it, you have pushed money out, but you have not created growth, nor have you created jobs. And these mechanisms are important to make sure that the banks are making the right decisions, and only those banks that are making those decisions are allowed to actually grow. The second area, you mentioned the issue of DFIs and what to do about them. In the committee, we had spent some time looking at the wholesale banks as an overall structure. I'm fully in agreement that retail banking, we have to worry a little bit about self-dealing and not bring in corporate-owned banks. But wholesale banks allow you to bring high-performing corporate-owned NBFCs into the system. They allow you to focus on some of these infrastructure, long-term lender, while the bond market develops, or as adjacent to the bond markets. And then, of course, stock market clearing corporations. Many countries around the world give them a wholesale banking license so that they don't then have a credit guarantee fund. They can do movement of money and securities instantaneously. It allows also the regulator to step in with LOLR functions. The other thing that it does, coming to the question of SMEs and extending credit, is it then gives you a pathway to take the larger, too big to fail NBFCs into the wholesale banking frame, which means now you can allow the smaller NBFCs to proliferate, to become specialized, because you don't have the fear that if somebody does badly and they fail, you will have a systemic shock. Today, we have a situation in which we have these large NBFCs. We are worried that if they have any shocks, we have no ability to actually rescue them. And then, of course, finally, we have to acknowledge regional disparity in whatever we are doing. Priority lending has been focused on sectors for a long time. And I'm not saying, therefore, that's a bad idea. There is still sectoral disparity. But today, the policy does not officially recognize the fact that sectors have a high level of imbalance. And again, another aspect of banking is we have said to every bank must do everything. If you're an international bank or a local bank or a bank with a lot of branches, with no branches, you must do agriculture, you must do this, you must do that. I think the idea has to be less, let's punish everybody equally, much more making sure that people can specialize, so that in aggregate, the banking system is doing a good job of providing these services. And then also, I don't want you to have the impression that nothing has happened. I mean, we have had progress. The small finance banks are doing well, but clearly, as you point out, we do have several steps we need to take.
Thank you. I think both those are excellent interventions. Very useful. So if we were to pick one item, so if I was a policymaker, or if you were advising the government on one thing to do, because clearly there is limited bandwidth in terms of the extent of reforms that can be undertaken. What should we go ahead with? I mean, should it be unshackling the PSU banks, because those are an already existing entity? Because I think the problem right now is that the banks that have the savings and the capital do not have the products, and where the products exist, there is a clear problem of a focus on survival, which is the NBFCs. So and one of the reasons why our debt to GDP is so low is high level of informality. So if 44% of your GDP is informal, almost by definition, a very small percentage of that can actually access formal credit. So formal credit to formal GDP is already 90-95%. Now, so how to increase the formalization process? I mean, should it be PSU banks who take the initiative? Should we try to focus on reviving the NBFCs? In my personal view, that may be the best way forward. So, maybe Dr. Moore, if you would have a preference or a pick on if one of the things had to be done, what would that be?
I would start with a foundational effort. We really need to get the banks to be strong. And if we have limited bandwidth, I don't see why we should have limited bandwidth, because these are all different departments, different divisions of the government, of the Reserve Bank, that can act on them simultaneously. But if we had to do one thing well, I would say make our banks strong. This idea that you can push a bank to push credit out on demand, it just does not appeal to me. We need to make sure that we build the transparency of the bank balance sheets. And that's going to take some effort, but banks are almost ready out there. Now, some of the banks may look less capitalized than we thought they were, but that's, we are just going to acknowledge a reality that exists. It's not as if we're going to make them less capitalized. We're just going to make that visible to ourselves. Then what happens is we can identify truly those banks that are doing a good job of it. Make sure that they are allowed to function well, the capital markets see that they are doing well, so that we direct growth, capital, savings at those institutions that can do the intermediation well, and away from those institutions that have a demonstrated track record of doing a bad job.
Thank you, Dr. Subramanian. If you were to pick one thing that of the large number of things that we need to do, and there's clearly a lot of work to be done, what would that one priority be?
Neelkant, I would actually build on, I think, an excellent point that Dr. Moore made about ensuring that the allocation of credit is done well. In this context, I would actually make two interrelated points. One of the key problems we've had, especially in the allocation of credit, is credit to the large borrowers. We've had repeated instances, of course. Now some of this has come into the open, but even earlier, even in the 90s, we've had situations which would be unthinkable in an advanced economy, where a borrower has serially defaulted and yet ends up getting loans. So it's a flagrant violation of this principle that Dr. Moore talked about, which is that credit allocation has to happen well. We can't be actually giving credit to those borrowers that did not seem to have the willingness to repay. And here's where I think more generally I want to talk about the role of technology and fintech in this area. I draw on my experience. I remember my BTech dissertation, this is decades back, was in applying neural networks to electrical engineering problems. Today, artificial intelligence has built on that and is able to quantify even several pieces of information that hitherto were just thought to be soft or not quantifiable. We all know about the AI software basically beating Garry Kasparov, in a chess game, which is actually far, far more complicated than the move that a willful defaulter might do. So I think in the way in which our banks actually use data for banking, and especially on the corporate lending side, we still are a few decades behind. Not only do we need to ensure that high quality data is collected, but we also need to ensure that those data are actually analyzed in ways that today, there's enormous opportunity to be able to do it. And thereby, and really clamp down on, for instance, just to give examples, this is something that we highlighted in the economic survey as well. If you just use the quality of financial statements, such a strong correlation with willful defaulters, it's a very good leading indicator. Or if you just look at the extent of related party transactions, loans, related party loans, these are all out there, and these are basically, oftentimes in informal conversation, these are mentioned. But today there is the opportunity to be able to actually mine the data to really being able to, direct credit properly. So what I would say, for me, the number one most important, irrespective of the nature of ownership, and I will actually highlight that even the private sector banks, some of those banks that we think are actually at the cutting edge of the technology frontier, I'm actually disappointed to say that that is not the case. When we compare with some of the global peers, even they are far, far behind the frontier in terms of actually the way in which data, technology, AI, data mining, fintech can be used. I think that is, to me, the most important, that we need to do. And hopefully the banks can take a lead, and or maybe even NBFCs, and there can be then sort of osmosis, either if forward osmosis or reverse osmosis. But to me, this is the most important. I think today, banks and financial institutions should be thought of as just technology companies and really be able to exploit the benefit of technology. I think that is number 1, 2, 3 for me.
Thanks, Dr. Subramanian. That's I think, if I may add a few more comments on that. So one of the things is, in most global banks, IT departments are more than 50% of the workforce. So if you have 45,000 people in a bank like ours, and I have 25,000 people in IT, that shows how important technology is. And there are many interesting and fascinating. If there is one positive thing that is coming out of even this crisis, is a step jump in digitization. So one of the first things to reach February levels in growth was UPI transactions, and so even the IMPS, which is UPI is a build up on or a layer on MPS, is actually now growing at 90-100% year on year. And similarly, some of the recent changes on GST, where you can actually allow, with some changes, invoices to be used as collateral. I mean, evidence of cash flows. Is something that can actually allow some of these things to scale up. So now changing back a bit, moving to the second problem, which is that in our in the current environment, the loss of GDP, one hopes that the day you switch on the economy, or the day the economy switches on, everything should come back to what it was in February. But unfortunately, it's not going to be like that. And over and above the scars that we discussed of how people's behaviors, enterprise behavior may change, there's also a reduction in risk capital, meaning that firms which would have generated, so if we are, say, losing 10% of GDP this year, if you're going, say, from +6% to -4%, which I think is it could be a lot more than that, but even if it's 10% of GDP, the loss to corporate retained earnings could be as high as 5 trillion rupees, I mean 2.5% of GDP. And if you think about 1:1 debt equity that generally gets taken, we're talking about nearly 5% of GDP worth of gross fixed capital formation not happening. And these are things that can have a lingering impact and a lasting impact on growth. Now, in the next 2 years at least, there is clearly a much bigger role for the government than we have seen in the last 30 years, right? Because the government may be the only entity standing. So again, starting with Dr. Subramanian, so one of the constraints in government fiscal action appears to be, so earlier, of course, when there was a lockdown, there was no need for the government. Actually, it may not have had the best multiplier if the government was giving a demand boost. But now that the economy is more or less open, now is the time to supplement demand through government actions. With asset markets globally, with excess money supply boosting stock prices, now you must have seen state governments are now borrowing at yields which are comparable to that of the central government. at short durations. But so these kind of so cheap capital is starting to become available. Do you see growth being the priority of the government from now onwards? And if you could even give the broad directions in which the government may be thinking on how to revive growth.
So Neelkant, I think growth has been the priority for the government, and I will make comments on the demand side. But let me just use some international experiences to actually highlight why, in times like these, if government indeed has to step in. Whether it actually was the New Deal, that happened under President Roosevelt in the United States after the Great Depression, or if you look at the Marshall Plan, for Europe after World War II, many instances like these, whenever an economy has gone into crisis, of course, the government, has had a crucial role to play, in actually stabilizing the economy and spending, doing the necessary spending. On that, I have absolutely no doubt. I'm very, very clear on it. But, and this is a very important point that, needs to be kept in mind. You, for instance, were referring to the precautionary motive to save. So while there is no denying that the government needs to actually, give work on demand and give a demand side push, getting the timing of that right is also very, very critical to ensure that the bang for the buck is actually maximized. And what am I actually talking about here? As you were saying, because of the precautionary motive to save, and remember that this precautionary motive to save stems from uncertainty, what we economists think about as a second moment. And that uncertainty itself is stemming from the health emergency. Unlike other crises, whether the global financial crisis or any of the Asian financial crisis, LTCM, etc., where the uncertainty stem from economic factors. In this case, the uncertainty is from the pandemic. Until that time, that uncertainty persists. The precautionary motive to save will remain with individuals and with corporations. And this is actually seen, research, for instance, for the United States is showing that the checks that were sent to people have primarily been utilized in essential spending, especially on food. There's been no impact on durable consumption at all. In India as well, if you look at the PMJDY accounts, the balances there have increased by about 18,000 odd crores. Now, remember, these are accounts where the marginal propensity to save is actually very, very low, and yet they've increased by 450 to 500 rupees. In other words, what I'm saying is because of the uncertainty, and Joseph Stiglitz wrote on this as well. If we do this, in sectors where the demand will not pick up because of the uncertainty, the bang for the buck may not be quite right. In other words, I think when the uncertainty actually subsides, that would be the optimal time to actually give the demand side push. In other words, to summarize, what I'm saying is there's absolutely no denying the fact that the government has to be the biggest, role has to play the most important role in the economy and provide a demand side push. But I think the timing of that, just because we've come out of the lockdown, does not mean that the uncertainty has fully gotten over. So we still need to wait for people to resume all normal activities, and then that's when I think the timing will be best for the bang for the buck to be maximized.
Thanks. I'll come. I have some follow up on that. So if I could get Dr. Moore's views as well. So small micro enterprises are likely seeing the worst erosion in risk capital, right? So we are seeing some very large companies now do rights issues. Some of them are getting inbound FDI. The access to bond markets, the yields are now very low. So I think they have less of an issue. How does the government really, a small wholesaler whose markets are still shut because there is crowding, and say, half of Mumbai is right now in containment zones. So the wholesale markets are not functioning, and the poor thing, all of his risk capital is now being consumed in feeding his family, which is of course the highest priority. Now, how do we get these, people with 50 lakh, 1 crore, 2 crore of risk capital, and there are crores of them, to get risk capital to them? Is an aggregate demand stimulus the best way to do it? Because there's no way you can target these millions of small enterprises.
mean, I'm no fiscal expert. Dr. Subramaniam would be in a better position to answer your last comment. But I mean, certainly during a crisis, what I have seen around the world is a fiscal support is quite important to individuals and to businesses, because what happens to businesses transmits back to individuals in a survival mode. Right? But my sense is that, as Dr. Subramanian said, as the uncertainty relating to health starts to subside, and it will, this disease is not a disease that will kind of cause the shocks that Ebola or some other contagion would have had it gone to this level. It will take time, but it will subside. The question that I'm a little bit anxious about is what are we doing and thinking about those issues as we plan for that opening. My own thought, and again, in the role I had as a banker, SME was one of the portfolios I looked after. While it is true that the SME sector as a whole is a vibrant, active, important sector, the individual SME is a high-risk entity. It has a lot of information asymmetry, and attempting to push cheap credit at them, and by forcing banks to do something or trying to find ways to get equity to them, except as a fiscal relief measure, that's a different kind of approach. I think will be dysfunctional because it will hurt banks. It may not necessarily select, to stay with the theme that we had earlier, the right SMEs that will grow and survive in the environment that emerges tomorrow. Now you might say, okay, well, we don't do that. Then what are we supposed to be doing? Well, one thing to recognize is that the SME is subjected to a lot of systemic risk. And a better strategy would be to try and understand what can we do about the systemic risk, because you can raise a lot of equity, you can raise default thresholds to say, please go ahead and default, because we know you have a lot of systemic risk. I think a better idea is to look at what those systemic risks are. And clearly, for example, payment uncertainties from government corporation, from large companies, is an enormous source of systemic risk for the SME. What can we do about that? The TREDS platform is there. Can it be opened up? Can it be made more participative? Why only banks must participate? Why can't everybody participate? Why must it be fully non-recourse? Why can we do, we allow a lot more play in that market. What about demand? For example, we are focused on SMEs directly, but actually, aggregators like Ola, Uber, many of these entities, they take away demand uncertainty. Today, for example, many restaurants are surviving because Swiggy, Zomato, these players are able to tell you where is the demand and give them some assurance of traffic. What can we do to support those entities? Because they are much more amenable to regular structure, and through them, we will get more of this to happen. Operating leverage. Many of these SMEs have, cannot afford large investments. They have a lot of operating leverage. I learned recently about an organization called Hungerbox that, for example, digitizes restaurants. It takes on the fixed costs. The restaurants pay only the variable. And then, of course, finally, this point that I mentioned earlier, that if we are able to deal with the problem of the large NBFCs and allow them to migrate into a wholesale banking type structure, even if they are corporate-owned NBFCs, then we can allow the smaller NBFCs to become much, much more vibrant. Today, we deal with them very conservatively. We insist on excess capital requirements because we think of them as in some form of quasi-banks. If we started to worry less about them, we would have actually less pancaking. One thing that people are not, it's not always obvious to people, is that if you look at lending rates of SMEs, that SMEs face from NBFCs, a lot of that comes because they need to service high levels of capital that they are required by regulation to hold. So again, building specialized NBFCs. I've seen in education, for example, in private schools, there are specialized NBFCs have come up. In the US, there is an entity that focuses on primary care NBFCs. Primary care as an SME and an NBFC supporting the growth of that. To me, these approaches seem like more promising ones as we go forward.
Thank you, Dr. Moore. So that's quite fascinating. In fact, that's where the role of pro-cyclical versus counter-cyclical macro prudential measures. So for example, should we be relaxing the debt equity measures for NBFCs or increasing them? And I think those are important questions. So, but both of you highlighted this persistent uncertainty on health, and I think while it is not directly related to economics, but given that this whole crisis has been driven by health, and it has really exposed the differences between countries. I mean, look at Vietnam, how it has dealt with the virus, despite having, I think, resources which are more comparable to ours, or how Taiwan has dealt with it. So one of it is, of course, just the experience of having dealt with pandemics. But if we were to think about healthcare as something that gives the comfort, so Dr. Subramanian talked about the uncertainty which is causing precautionary savings, people have fear. Now, if you had a certain comfort that the infection fatality rate of the virus, for argument's sake, at a certain age group is say 0.2 or 0.1%, and if needed, people will get access to medical care, and that there is sufficient bed capacity, there is sufficient oxygen capacity, and this may not be the last virus, and this is not going away in the next 6 months. I think, including me, I mean, all of us are hoping that this goes away somehow magically in the next 3 to 6 months. But for all you know, it could be around for the next 12, 18 months. And we've seen a new virus every 3-4 years. So should we not? And this is again to address one of the points Dr. Subramanian raised, that because the multiplier is not going to be big enough, is healthcare the sector where government spending, setup of new centers, new hospitals, new diagnostic chains, whatever, so the capital expenditure there will actually have a massive multiplier because it reduces the uncertainty. Now, Dr. Moore, I want to start with you on that. You've written some fascinating posts on how to address universal healthcare in a country which is constrained for fiscal capacity. I would like you to just explain that. I think that's some of those ideas are absolutely fascinating, and then we'll build on that.
Yeah. No, thank you. I completely agree with you that health is an area which I think has surfaced as one of those issues that needs attention. And you're quite right that there is differences between countries in terms of how we have responded, what has happened to these countries. And India, in some cases, has done very well. We have a statewide variation within the country. You mentioned Vietnam. I would have mentioned Kerala, for example. And you can see that there are good responses and there are responses that are found somewhat wanting. And of course, as you said, crisis is not over yet. We will watch and see over the next 12 months how this thing all pans out. What can be done in our country, both near term as well as we think about long term? Clearly, one area we just have to prioritize is public health. We can't be in an environment, we are focused on COVID-19. People are not always conscious that we lose 1,200 people a day on tuberculosis. Something that most other countries, including China, has dealt with quite effectively some time ago. Right? Why is that? Right? We know, at least to a reasonable approximation, what to do. There is clearly multi-drug resistant TB, all of those issues that we need to worry about, but it's a much smaller proportion. This work is actually quite a bit incomplete. We don't have a surveillance machinery. Where are the epidemiologists? Where is the machinery that tells you how the disease is progressing? We talk about contact tracing, we talk about quarantining, we talk about, how are we going to create containment zones? The public health preparedness, I think, has made a big difference between states and between countries. And I would say this is a real opportunity, and particularly in this case for the government, to look inside and say, we are doing a lot of private health. We are entering spaces, of surgery, of hemodialysis, of many areas. Maybe what we should do is really first finish this task of public health, and also what they call, there is one thing called public health policy, and then there is healthy public policy. Just to give you an example, in Bombay, we have this whole scheme of slum redevelopment housing. Post the bubonic plague in 1896, a rule was passed that between two buildings, there would be a 63.5-degree angle that would make sure that the buildings were, sufficiently far away from each other. And if you go to BBD Chawls in Bombay, you'll see in 1926, they were built fully compliant. If you go to the more recent SRA, the Slum Rehabilitation Act buildings, Natwar compound, for example, that entire rule has been ignored. And somebody did some very nice research that showed us that the level of TB changes based on the floor you live in. People on the lower floors have higher incidence of TB than people on the on the lower floors have higher incidence of TB than people are living on the higher floors. We just, we really have to sit down and fix this issue in a comprehensive manner. That is how we will prepare ourselves for pandemics. Second issue, now you might say, well, there's lots to do. And as you pointed out, we in India, and we are not alone, Nigeria is a country that has had oil revenues for a long time. They are in a similar boat. Fiscal capacity is not there, or there are other priorities that call attention. So governments have not spent the amount of money required. I continue to believe that this is something they should do. Many countries have done it. Thailand has done it. China has done it. But it will require a tripling of health expenditure, not small amounts of 5, 10, 15,000 crores here and there. That will take us time. In the meanwhile, and this is what I've been writing about, we have been, I feel, somewhat ignoring the fact that people of India are spending a lot of money on healthcare. How can we add value to that process? And I believe a lot can be done. For example, in Singapore, the idea of the catastrophic health insurance, very high cost procedures. Every citizen has that insurance. Now, in our markets, we can enable creating these. And the good thing about these insurance program is because they may be high cost diseases, because the probabilities are low, the actual premium is quite low. How can we universalize so that every single household has access to this catastrophic insurance product? It could cost 25, 30,000 crores, well within the means of the government, but if the government chooses not to spend on it, there are ways in which we can activate private markets. Then I would say, what about primary and secondary care? We really need to strengthen that. Even in this crisis, one of my concerns has been that we followed a strategy of what I call, centralize, hospitalize, ventilate, when we knew worldwide that those strategies were not working very well. What about distributed oxygen capacity? What about making sure that every small clinic and maternity home had a simple 40,000 rupee oxygen concentrator that allowed you to give you 5 liters of oxygen for anyone that needed it? You're hearing horror stories of old parents running around trying to find basic oxygen. I feel that the whole primary care infrastructure needs attention. And, we don't have enough time to get into it just now, but I do believe that there are viable, interesting ideas coming from business schools, from other businesses, that we can learn from to actually figure out that even in an out-of-pocket environment, government doesn't have the money. If they did, we have other tools. We can actually build good primary and secondary care. So I would say strong public health, universal catastrophic insurance, and a really robust approach to building a high-quality network of primary and secondary care, assuming out-of-pocket expenditure.
Thank you, Dr. Moore. I wish really we had more time to discuss that. And I want to pick Dr. Subramanian's brains on some of the things that you mentioned. So when you talked about the fact that SRA, the distancing norms are not being met, there are issues around, too over-regulation of building, etc., and why buildings take 2 years to build and therefore add to the cost, etc. But I think those are very important points because, one of the ways in which or the point at which the disease spread in Mumbai seems to have slowed is when 10% of the population left, right? So the migrant workers leaving Mumbai, I think, add up to 10%. I would say even more. No one knows the number. And the decongestion of the chawls and the slums was very important for this to happen. Now, is this an opportunity in a sense that people now realize that living in congestion, therefore the social acceptance of rebuilding, the social acceptance of moving to better quality, affordable housing, and therefore as a multiplier, if you think about another government boost I know these are state subjects, both health and residential real estate, but a government boost to affordable housing, a renewed push on that, and not just house ownership for all, but just housing for all, meaning you can even rent facilities and you can have people investing in 1,000, 2,000 tenement buildings and then renting them out. So are these fiscal options that the government can consider? Dr. Subramanian.
So, Neelkant, I actually want to, string together some of the thoughts that Dr. Moore has highlighted on healthcare. And I think one of the key points that has emerged during our discussion is the fact that there is undeniably uncertainty on the health front, and it's not restricted only to the current episode of COVID. In which case, then, reducing uncertainty itself, can create enormous benefits. And that's where I think I would bring together three key aspects. One is, insurance. We all recognize that insurance is something that will really reduce, uncertainty significantly. A second aspect that I think is very important is focusing a lot more on prevention. And here's where, again, I want to pick up the example of what we've been doing, in the COVID pandemic, and relate to what something that has been there in our, culture, which is, you step out of your house, you come back. As a young kid, I always used to be told, wash your hands, wash your legs, and change your clothes. Now, these were things that were part of our culture. The reason I'm bringing this up is to link it to, something that we wrote about in the July 2019 economic survey on nudge, the behavioral economics of nudge. When you have practices that have been part of your culture, it is very easy to tap into those to nudge people, and that can play a significant role in prevention. And prevention thereby can be utilized to reduce this uncertainty. For instance, now a lot of immunity boosters are being talked about. But one would expect that immunity boosters should be something that we all invest in at the micro level, even in normal times, and because that enables prevention. A third part is something which is related to, again, what Dr. Moore mentioned, which is the out-of-pocket expenditure that happens, and really, in fact, that is what oftentimes leads to debt traps for really poor people, and that's where I think the insurance aspect, some of the preventive medicine can be really useful. Of course, I think we also need to increase the fiscal spend on this. But even within the spend that happens between the center and the states, it's quite dispersed. We can still bring them together, and thereby, for instance, bringing together defense spending on healthcare, CGHs, railways, bringing them together can also give us enormous bargaining power, and thereby be able to actually, bargain as possibly a monopoly, and thereby being able to make, healthcare far more affordable to the masses, and thereby reduce uncertainty at the macro level of the economy as well. So these are, I think, one key thing that has happened. As they say, there's always an opportunity in a crisis. That the role for these, whether it's insurance, whether it's actually bringing together various arms of government or focusing on prevention, the role that they can play in reducing health uncertainty, I think, has really been underlined through this crisis.
Yeah. So thank you. I think those are all excellent points. And again, I wish we really had more time, but now we have to open up for audience Q&A. I believe we have a question from Mr. Ravi Suryanarayan. Mr. Suryanarayan, can you go ahead, please? Sir, you're on mute.
My question is really, twofold. One is on the institutions, looking to our banks. And I know banks' problems have been lingering for a long time. We are addressing it by merger, etc., etc. But one chief thing which I think is not getting addressed is lending to services. And our economy is turning towards services. There may be a lot of models in the books, but nothing has come out to bazaar. And banks are, I don't know if banks are really the instrument through which you can reach cash flow based financing to the services industry, or it should be through an NBFC model. But I think there we are kind of delaying, and there is no model which is known to the bazaar, to the SME people, that yes, they can get cash flow based financing, which is not based on security. The banks are overly obsessed on kind of security, collaterals and stuff like that, and that's not really helping. So there is a problem in credit delivery which is at root, and it requires some systemic reform on cash flow lending, which I'm not sure which is getting addressed, and it is getting communicated, that the address is getting communicated. That's one part of my question. The second part of my question is really building up on Dr. Subramaniam's demand booster to wait for getting the best buck out. Is that, I'm not a great expert. I'm sure they are expert and they would have applied my mind, but as a common man, should we not start ahead? And there are a lot of things on government procurement. Do we look at it really like a private capitalist to say that I have to maximize the bang on the buck, or is it to get prop up because it's going to be a time-consuming affair? It's not that you put money and you can into the system and you can expect results. You have to start ahead, and therefore is there in the government procurement systems, the tendering systems are really cumbersome for SMEs to participate in them. There are a lot of systemic reforms and stuff like that. So is that something which we need to look at the systemic level? These are two of my questions. Thanks.
Okay, Dr. Subramaniam, do you want to address at least the second part? The first question I didn't understand, but it was a good statement, but it was a statement where I didn't get the question. But second part, clearly, I think there was a question to you.
No, Nilkant, I think there was a good question even on the first part, which is I think the case is absolutely correct that almost 90% of our lending is secured lending, and what I spoke about earlier, the use of technology, analytics, etc., to enable cash flow based lending. I think that's something which is a very, very good point. While I definitely see role for the government and regulators as well, but I also see a significant role for the private sector. This is a space that is waiting to be disrupted, and I hope that a lot of fintech companies are working on utilizing this, because India is a more service oriented economy, and so cash flow based lending, using analytics, using transaction level data to actually infer both ability to repay and willingness to repay is work done. Your second question, I think, again, see, this is, we don't have the time for a nuanced discussion, but what I'm trying to say, I'm not denying there is absolutely very, a crucial role for a demand side push. I gave the examples of the New Deal. I gave the example of, the Marshall Plan as well. What I'm saying is that some sectors where the demand, take tourism, for instance, till the time that the uncertainty is there, it's unlikely that the demand is going to come back. And so, one has to think about, I do certainly agree with you that we are definitely preparing for it undeniably, and trying to front load, for instance, infrastructure spending, because we know very well infrastructure, because it relates to construction activity, a lot of jobs are created. And so employment has to be a key aspect of the demand side push, because if there are layoffs and retrenchment, that can have an impact on demand as well. And that's why a lot of the measures that we've taken on the liquidity side, focused on MSMEs, are really to ensure that demand is retained, at least for a lot of the essential items and for many of the discretionary sectors as well. So to summarize, I think we are certainly aware of the need for a demand side push, and the fact that government has to play a key role. We've already taken steps through preserving employment and giving a lot of liquidity to the MSMEs, in the earlier kind of measures, and we are working on measures currently. What is critical to recognize is that, even if you put cash in hands of people, it may not translate into a buying of a car or buying of a house, because people will say, I might possibly need that money for healthcare expenses. So that's the point that you have to recognize. That's the timing, that's the aspect of timing that I'm actually referring to.
Thanks. Thank you.
Thank you. The next question is from Mr. Satyam Vyas. Mr. Vyas?
Yes. Hi, thank you so much for a very, very insightful discussion and comments today. My question is to Mr. Subramaniam or Dr. Nachiket Moore or Dr. Subramaniam. So I'm a founder of a social enterprise called Arthan. We build capacity of civil society organizations in India. So civil society approximately employs 7 million people and supports government in addressing some of the most complex challenges that we know. And we noticed a lot of that during the COVID pandemic. So there are reports and estimates that the funding for the civil society is going to go down by 30 to 60%. That might mean that 2 million people approximately are going to lose their job. So my question to Dr. Subramaniam is, recently a stimulus package was announced for MSMEs by the government. Shouldn't there be a stimulus package for civil society organizations?
I think this is a difficult question. Undeniably, there are sectors, not just MSMEs, but other sectors, as I was mentioning about tourism, for instance, which possibly need attention. At this point in time, we focus primarily on ensuring that MSMEs, which account for almost 98 to 99% of the overall employment, overall number of firms as well. So we focused on giving them a lot of attention, ensuring that employment impacts are minimized thereby. I do want to point out that I think this is a broader point that must be kept in mind, and this is again I say this based on behavioral economics. Yes, that some of these statistics that you're mentioning I am paying attention. We should pay attention to it. But at the same time, there is also something that you should keep in mind more broadly, which is what behavioral economics call the saliency bias, which is when we are in a time when in normal times we do not think that a black swan event is probable, and when we are in a black swan event like this, we don't think that we'll be back to normal times, and that's what oftentimes can lead to a lot of very pessimistic projections as well. I'm not denying that we are in a difficult time, but as Dr. Moore, somebody who actually understands health,
Okay, I think so. We are seeing some bad connection. We're quite fortunate it's happening right at the end. But maybe we can get Mr. Kilachand's question in while we wait for Dr. Subramanian's connection to improve.
Hello, thank you, Dr. Mishra. And this question actually is for Dr. Subramaniam. So I don't know whether his connection has come back or not. And the question really is that over the last 8-10 weeks, there seems to be a convergence, amongst leading Nobel laureate economists, the leading economists at the IMF, the World Bank, and of course, leading economists at some of the, major global academic institutions on a direct cash benefit transfer. And that number seems to be somewhere around rupees 7,000 per month. Now, obviously, I've heard Dr. Subramaniam say that demand side stimulus, could be a timing issue. But there seems to be, and these are all colleagues, I'm sure, of people in our finance ministry and Council of Economic Advisors and RBI, who are, obviously been trained in these same institutes. There seems to be a resistance on the part of our government not to listen to these voices. So the question is why?
Okay, now I'm not sure if either Dr. Moore or myself are qualified to address this question. And anyway, I think I'm afraid we have run out of time. So at this point, and we've lost connection with Dr. Subramanian. So we'll try to get that answer to you, Mr. Kilachand. And let me thank Dr. Moore and in absentia Dr. Subramanian for joining us in this fascinating panel. And I look forward to continuing this discussion offline as well. Thank you very much for looking at the show. And
thank you very much for having me.